everyone, so I'm here today to talk about auricular acupuncture. This is one of my favorite types of acupuncture. I've always enjoyed doing ear acupuncture. The ear represents a whole map of the body. Pretty cool. If you picture, I'm going to bring up my favorite ear here that you've seen before. The ear represents a map of the body, and if you picture an upside down fetus, that is how it's represented with all the points. So the head is going to be down here, and then you've got all your internal vital organ systems in the middle, and then this is the spinal column all through here, and then up here we're getting more into the tail, the bottom of the feet, etc. So shoulder, hip, knee, etc. So you just think upper body and then lower body. You're flipping upside down, an inverted fetus. So many different points on the ear. It's a map of the body, kind of like reflexology. So when I go treat my patients over at the hospital that have just had surgery, a lot of them have had a hip replacement or a knee replacement. I can't treat right away on that area, but I can treat right here. I can treat the hip and I can treat the knee, which is pretty cool. Maybe you can see that here. And then there's various other points. Like I had a patient the other day who just had a total hip replacement, and she had low back pain. It was the day after her surgery. So I ended up doing the low back area. And what's really cool is you can look when you're diagnosing to see where's a good spot, so you can get really specific, and it can show redness, a swelling, inflammation, a sign of inflammation there. And that's usually where I want to put the ear needle. So ear needles can be placed, and then I can also put on an ear seed, which I will show you in just a bit. But the ear acupuncture can be used for so many different ailments, not only pain, but really everything from A to Z. We can treat digestion, we can treat emotions, calming the mind, transforming the mind. I also use a point for TMJ, which is the jaw point, and that one is right here. So again, I'm looking for a redness, a swelling when I'm looking for which area of the jaw on the ear, that lobe that I want to treat. So it's really cool how many different things we can treat if we're not able to get to the body. And it's a really great way for a patient to experience and get over the fear of acupuncture needles, before they experience a full treatment from head to toe. So I don't have any of my needles with me, but I do have the ear seeds that I can share with you. And then another common acupuncture treatment that I use with the ear is any type of addiction. I also specialize in weight loss and weight management. So typically we don't want to put more than 5 needles in the ear, on each ear, so a total of 10 needles, because it's just too much energy rising up to the head. So you really want to limit when you're needling the ear, 5 points per ear, total of 10. But there's certain protocols that we use for addiction, be it tobacco, drug addiction, and then there's also food addiction, which you can link up to weight loss, weight management. So I'm using my 5 different points, which I'm going to go into the weight loss on another video series that I'm going to be doing on weight loss and weight management. But just know that that's to come. And so I would be placing my ear needles first, letting the patient cook, and then afterwards, if the patient would like to be able to keep stimulating that point, then we can place these little Band-Aid like ear seeds. Now these have a particular pellet That's an herb which invigorates the blood. This little black is a pellet, and that's what you're stimulating. It's kind of creates like an acupressure effect. So we're going to peel one off just like a little band-aid, and then there are little stick-ons. People ask, well, how long can they stay on? They can stay on for, I usually say, up to a week. After then, you know, I think it's good to change them out because it can start to look grimy, or it might feel like it's getting embedded in there, which we don't want. Obviously, if it's uncomfortable, you just peel it off like a band-aid and throw it away in the trash. So this is the ear seeds, and a lot of times, or different ones, will be silver, and then there's also gold pellets. But this is an herb which invigorates the blood, so it's going to stimulate the point really well. And then you're just going to go ahead and place it. Let's say we have the hip pain patient that I just got done seeing this week. I'll stand up so you can see it well. Hip. So I'm going to place that ear seed right here on the hip. In fact, I just did this earlier tonight on a patient. And then I also like to put this one on. I already have this one on for calming the mind. So we've got calming the mind, and then we've got the hip point. So with the ear seeds, you can do just a nice little gentle tap tap. You can do a circular massage on the point, and you can do a press and hold. So whatever is working best, and you stimulate it whenever you're feeling like you need to calm your mind, or you're having pain, or you can stimulate both at the same time. And sometimes patients will get immediate pain relief. This is a really, really, can be a really, really great treatment. Sometimes it's subtle, and sometimes it's significant. Sometimes it's somewhere in between. But the ear seeds, you know, can be changed out every 3 to 4 days, up to a week. Like I said, if they are hanging off, you would just peel it off. So I really love ear acupuncture. I think it's so wonderful as part of your treatment, or even if you're doing like a group setting, you don't have a lot of time, you can do everybody in a group and experience ear acupuncture. So if you like this video, please give it a thumbs up. Please subscribe. Please push the bell icon to always be notified of my weekly videos, which are coming out every Friday. And I welcome any comments, feedback. Would love for you to share. And wishing you many, many happy, healthy blessings. And I'll look forward to seeing you soon. So take good care. See ya.